the complications of sickle cell. What are the complications now that you have these defective red blood cells clogging arteries and capillaries and vessels? What are the complications that will happen? Now, I want you to relate this to the diabetes, to the complications of diabetes. I want you to just type there one of the, because if you've been on this platform for quite some time, you already know the complications of diabetes. So please type there the complications of diabetes that you know. Any complication of diabetes that you know. Is priapism part of it? What are the complications of diabetes that you as a person know? Neuropathy, liver failure, loss of vision, neuropathy again, retinopathy. Oh goodness. You are better doctors than I am, than we are. Eyesight loss, yes, these are complications of diabetes. Kidney failure, thank you so much for that one, a major one. Shedding of hair, retinopathy. Diabetes retinopathy, yes, diabetic retinopathy is there. Skin complications, yes. Do not even, amputation is part of that. The diabetic foot. Oh, you guys understand this gospel. Vision loss, thank you so much. Coma is part of that. If coma is there, DKA, yes, DKA is a complication of diabetes also. If coma is there, there's one that you people are missing out. Here, what is that? Kidney disease, diabetes shock, yes. Stabbing pain, yes, the tingling. Erectile dysfunction is part of that. There's one that people are missing, the bigger one, the one that just, and most people die in the bathrooms. Lactic acidosis, not say diabetic ketoacidosis, okay? Yeah, because lactic acidosis is a different one. Memory loss, yes. Dementia, 101%. Low libido, yes. Good. There's one that I want you guys to mention, just one. That we blame cholesterol for. One complication of diabetes that we keep on blaming cholesterol for. Stroke. Thank you so much. You got it. We can now move on. Stroke. Heart attack is also part of that. Thank you so much. Now listen. We classified the complication of diabetes into two. We said we have the microvascular that actually concern the smaller blood vessels. And then the macrovascular. I am so glad that you people understand this message. Hypertension is there also. So we said that diabetes actually clogs your arteries because it forms a plaque inside the blood vessel wall. And when you form that plaque inside the blood vessel wall, what is going to happen is you're going to limit the blood flow towards different organs, whether the brain, the heart, the legs, the eye, all over, even the penis. When you do that, of course, problems start coming in. So stroke is part of the macrovascular. Heart disease is part of the macrovascular. The amputation is part of macrovascular. But loss of sight, which is retinopathy, loss of sensations, or the tingling, the needle-like injections that you feel, injections, or the needle-like piercings that you feel in the legs. That is a symptom of diabetes. We call it neuropathy. And then you have the kidney failure, which is called nephropathy. And when you have a kidney failure, anemia is coming in. So imagine if you're taking sugar and you are a person who has sickle cell anemia, double tragedy, because you're going to kill the kidney, and the kidney is the one that instructs the bone marrow to make red blood cells. So when there's no instruction to the bone marrow to make red blood cells, that means anemia. And now here you are having very few red blood cells that are already defective, the sickle cell anemia. So you're going to have double tragedy when you are taking sugar and you're a sickle cell patient or person. And then now the kidneys are the ones that control hypertension or blood pressure, sorry. So when you have defective kidneys because of sugar, not only are you going to get anemia, you're going to get hypertension. And now we'll start telling you avoid salt. But we're not telling you to avoid sugar that kill the kidneys. Do you see where the irony is? Every doctor is busy telling you, avoid salt in hypertension. Avoid salt, salt causes hypertension. But the real deal is sugar is the cause of hypertension because it destroys the kidneys. But of course, your doctor is under payslip, right? Anytime they write that prescription, they get a commission. Any speech that they produce that protects the sugar industry, because sugar industry is actually, nowadays, even medications, the syrups for children are logged in with sugar. So even medicines are coming in with sugar. So how do you expect a doctor to say no to sugar? How? How? Mention one medication that comes with salt. Most of the medications are formulated as salts, but mention one medication that comes with salt as an ingredient. One. You just hear the chlorpheniramine millet. Millet is a salt of Piriton. But mention one drug apart from no. I've not said a drug that is salt. Sodium chloride, which is normal saline, is actually a salt. But mention one drug that comes with salt as an ingredient. Now your doctor tells you that diabetes is a cousin to hypertension. So when you have a diabetes, chances of you having hypertension are high, right? And then he tells you to avoid salt because salt will cause you hypertension. And then the same doctor gives you normal saline when your blood pressures are low because of side effects of drugs for hypertension. Also, he gives you normal saline infusion, which is just salt, when your blood sugars are high to dilute the blood. So we can use salt to actually dilute sugar, right? But salt is a problem. It's a problem in hypertension. Don't take salt. If you take salt, take it cooked, not raw salt, as though sodium chloride will change form just because you cooked it. When you cook sodium chloride, I think it'll just form the ions, which is sodium and chloride, the same thing, right? But now, cooking salt is better than raw salt. Hey, yawa. Arino Diambo, hey, that was a good trial. ORS, that's a good trial. Now, mention any drug that has sugar as an ingredient. Any. Actually, let me narrow it down to you. Mention any syrup that has sugar as an ingredient. Any syrup. Let me even narrow it down to you. Mention any syrup for children that has sugar as an ingredient. Yeah? So these are the as you mentioned, these are the complications of sickle cell. One, of course, because of the clogging of the arteries. That's the major reason, okay? So one is stroke. You clogged arteries. Oh, Cello, thank you. Should I do this so that that spray comes in my armpit or something? So stroke as a complication of sickle cell. Why? Because we are blocking the blood vessels that supply the brain. So therefore, we limit the oxygen supply towards the brain, and then we have ischemic stroke. So that is one. And this is actually exacerbated by the sugar because sugar is actually clogging those arteries, and now you're having red blood cells that are actually deformed, so more problems. Number two, lung problems. This is called the acute chest syndrome, where you have the tightness of the chest, you have pains, and then of course now, again, these sickle cell red blood cells, what they do is they actually block oxygen transmission from the alveoli into the blood. So even if you have the least amount of red blood cells that can actually tap that oxygen from the lungs, from the alveoli, what happens is that these sickle cells that are clogging that transfusion or that transmission of oxygen from the alveoli, the diffusion of oxygen into the blood will actually make it worse. So even those less or the little red blood cells that are actually functional will not be able to access enough oxygen. Wayne, I am a nursing student. Do I count this as a free class? Yes, you can count it as a free class. However, know this, that if you ever write what I'm saying on that exam, yeah, start by trying, just a trial. Sometimes ask the questions that I ask here to your lecturer. You will see how the health system is corrupt. I appreciate that you're a nursing student and you're here. This is also the medical student, the pharmacy student, the nutrition students, the lab students. These are the questions that you actually put to your lecturers. When they're bringing these topics there and they're explaining it to you, ask them questions. And at some point you start to think, is this guy who is teaching me supposed to teach me? So when you persist asking them these questions, they become upset. And guess what? Utakunywa supu. That supplementary exam. Why? So if you want to be on the safer side, question, but make sure you pass that exam. Okay? Yeah, the system is very rogue. Sometimes on Monday I posted the MCQs that come in. Somebody shared MCQs that come in during medical exams. And the MCQs, the multiple choice questions, are so directional They are so directional because they want to condition the doctors. So some of those questions are just weird. They ask you the following function of cholesterol or the function of drugs that lower cholesterol, except they just condition you to think in a certain direction. And you know, multiple choice questions, they come with negative marking. So if you fail one, you have -1. So you can imagine. So your fear is just to give them what they want so that you can pass that exam. When you qualify, is a different thing now. You can question the system. When you have your certificate and your license, you can easily question them. But be very careful because again, they can come for your license. Number 3, multiple organ damage. Why? Reduced blood flow towards those organs. So the kidneys, the liver, the spleen, the heart, the brain. We are affecting them by actually causing these sickle cells. Number 4, gallstones. Now, gallstones occurs in 2 ways. One is, of course, those clogging of this the ducts by these red blood cells. But number 2, when the spleen clears these red blood cells, we release bilirubin. Bilirubin can actually cause you jaundice, which is the yellowing of the skin and the eyes. Bilirubin can actually cause you precipitate and also clog in the or form crystals that will cause you the gallbladder stones, the gallstones. So when you go for a surgery to remove the gallstones, but you've not fixed where the bilirubin is coming from, problems, right? Good. Of course, amputations and leg ulcers are coming in here handy. And then priapism, as we said, a very stiff, prolonged, but a very painful erection. Okay? Good. Well, having understood those complications, don't you relate these complications to dehydration and to diabetes? Can't you just relate those two? When you're dehydrated, these are the symptoms that you'll get. When you're having diabetes, these are just the complications that you'll get. So now you understand that these things are actually related. And when you go deeper into it, you realize the mutations that are coming in with the hemoglobin are actually sugar problems, are actually wheat problems, are actually seed oil problems. Because we said when you mess up the mitochondria, that's where mutations start from. But we don't want to actually boost back our mitochondria. We want to fix the pain. Pain is not a disease. Pain is a symptom. Actually, pain is very necessary in healthcare. Because pain is going to tell you that there's a problem in your system. But look at it this way. You have sickle cell, you don't want to fix the cause. You go and fix the pain through those painkillers. Some use the betapin, some use the tramadol, some use the NSAIDs. And we mentioned NSAIDs are very detrimental to your kidneys. And so is sickle cell. So you're using a drug to treat the symptoms of sickle cell, and then you end up having problems with the kidneys. Worse, double tragedy, right? So yeah, it's time for you to open up your eyes. And this is the reason why we give you the information. When you're informed, health system, the health gates will not see you. You only need information, the right information. But they are so clever. They put the wrong information in research, in peer-reviewed papers. Now, when you read that, you go with that direction, you become more sick, and you become a client for a lifetime. You become a slave. Our role is to get you out of slavery. Look at the US. Look at the West. They even give you a call when your prescription is ready. They even give you a call when there's a new drug for weight loss. They give you a call when your insulin is now restocked. The doctor gives you a call. The office of the doctor or the pharmacist gives you a call to tell you, hey, your new drug is here. Come, please. There's a new combination of drugs for diabetes. Please come. There's a new technology that is being developed for sickle cell. Please come. Anyway, so when you're trying to diagnose this, of course, there are multiple things that you can do. One is genetic testing. Of course, you see if we have the genes that actually cause this deformity in the hemoglobin. Number 2, complete blood count, which is called full hemogram. So we want to see the composition of your blood. And therefore, if you're having problems, we will know. Telegram channel yako uitwaje? It's called Health and Wellness Sport. Just go on Telegram and search Health and Wellness Sport. Thank you. And there is something called hemoglobin electrophoresis. This one identifies the type of hemoglobin that you have. So this one can actually identify if you have the defective S hemoglobin. Okay? So those are the mechanisms under which we detect or we diagnose sickle cell. Having understood that, 3 factors that will actually cause the defection of the red blood cells. Now, be very careful on this one, okay? So these 3 factors, apart from the genetics, these 3 factors are very important in maintaining the shape of your red blood cells. Because remember, everything you're talking about here is anemia as a result of the defective red blood cells. So what causes these defective red blood cells, apart from the, the genetics that they keep on telling you? One is low oxygen levels. Do you understand why I tell you part or one of the pillars of healthcare is actually oxygen? Your cells require oxygen. Therefore, walking barefoot, going to enjoy nature, walking a long distance, sometimes just going to the forest, Karura forest or whatever you want to go to, just go and enjoy fresh air. Oxygen is very necessary for your cells and your development in general. So you see, hypoxia is low oxygen levels. So low oxygen levels actually cause defective red blood cells. And that's why when you're in that hospital, they put you on an oxygen mask. Think. Number two, dehydration. Most of you drink water without adding salt. And when I tell you you drink water and you become dehydrated, you're like, how can I get dehydrated for drinking water? It is true. Most of you are dehydrated even when you drink those 2 liters of water every day. Ladies carrying 2 liters of water in their offices, sipping every single minute, but your skin looks so pathetic. Your hair is going. There's so much dehydration and you look dehydrated totally. So much headaches and migraines. But you're still drinking water. Why? It's because you're drinking water the wrong way. Anytime you drink water, either lick some salt before you drink that water or add a pinch of salt in that drinking water. It doesn't have to taste salty. Just add a pinch of salt. When you do that, what you do is the body will pick up the salt and then water follows the salt. And this water is going inside the cell. So that means hydration. But when you drink water, plain water without adding salt, now don't ask me about Himalayan and Celtic and all that. I told you, use the salt that you used to use when you're growing up. Did you know Himalayan pink salt when you're growing up? So if you want added advantages, you can use Himalayan pink salt or sea salt or Celtic salt. But table salt still has sodium, chloride, and iodine. Use it. So now, hey, I was labeled Shakaola master when I told people to fast. Everybody tells me, how can I fast with food in the house? Yeah, Daktari, I've worked so hard to make money to afford food. Now you're telling me to stay away from food. But I tell you, it's not about the money. It's about nature. Nature did not design you to eat all the time. Okay? So if you want to label me Shakaola for that, no problem. I accept that. Okay? So those 3 factors actually cause you more problems in red blood cells. Hypoxia, which is low oxygen levels. And remember we said, in sickle cell, we have the S-shaped hemoglobins, which actually clog and come together. They coagulate together in circumstances of low oxygen. So when you go and enjoy oxygen, you release this coagulation and you have an easy way through this. So hypoxia, we've said dehydration. So when you just drink water without adding salt, the next 5 minutes you are running into the toilet to urinate. You go there and urinate a clear urine, and they tell you urinating a clear urine is a good thing. But listen, when you're urinating all the time because you drank water, you're actually flushing out sodium. When you flush out sodium, you start having migraine. So that is basically you dehydrating yourself after drinking water. So for you to prevent yourself from going to the loo, lick some salt before you drink water, or add some salt in your drinking water. Even that concoction that you're making, that ginger, garlic, and all that, add in salt. It will take you a lot of time before going to the loo. Why? Because that water has been taken into the cell, and that is adequate hydration. Salt will not cause you hypertension. Salt will actually make sure that your blood vessels are flexible, and it will help you reverse hypertension. Trust me on that. I understand it. I understand the RAS system that actually brings about hypertension. It's actually designed to keep you on those medications. Because at the end of the RAS system, we have a drug that targets every stage of the RAS system. And I've addressed the RAS system on my other platform. You can go and just Google RAAS system and hypertension. You will see the answers. You'll see the answers. So don't blame salt for what sugar cost you, okay? It's time for us to now call the demon the demon. And you ask yourself, why are you so addicted to food? It's because of the sugar. Why are you so addicted to the fruits when the same vitamins in fruits are in vegetables? Why? It's because of the sugar. Why are you so addicted to the cake? Why are you so addicted to ice cream? Why don't you crave eggs, meat, the fatty meats? Why don't you crave all those things? Why do we crave for sugary things? It's because sugar gives us dopamine. So if you want to improve these 3 symptoms, if you want to improve hypoxia, which is low oxygen, go and do a walk. Go and walk in the forests. On weekends, walk barefoot to release the toxins and detention from your system. If you want to clear dehydration, drink water that has salt. Your red blood cells will go back to the normal form. If you want to do away with, number 3, I had forgotten, number 3 is acidosis. So 1 is hypoxia, low oxygen. 2 is dehydration. Number 3 is acidosis. Acidosis basically means you're dropping the pH of blood. When you drop the pH of blood, you go into acidic state. And that can actually cause you problems with the kidneys. And most of the times, acidosis is brought about by dehydration. So if you want to improve hypoxia, dehydration, and acidosis that actually cause defective red blood cells, 1, fresh air. 2, hydrate with salt and water. 3, diet. Drop the inflammatory foods completely. So if you have a child who has sickle cell, if you're a person who has been diagnosed with sickle cell and you're just wondering, when will I get to 40 to die? It's time for you to start doing these things. Free therapy. Fresh air is free. Sometimes get out of that city setup and go to the mashambani. Go and just connect with nature there. Go and walk in that stream. City life is very chaotic. Number 2, dehydration. Fix that dehydration with salt and water. Simple. Free therapy. Salt is about 30 shillings, if not less. Number 3, diet. You will tell me that diet is expensive, but I'm telling you, seed oils, wheat products, and sugars are the most expensive in your diets. Do away with them and substitute with healthy foods. Number 4, exercise. Now, you don't have to pay for a gym subscription to exercise. Those people who are in my weight loss group know. At 5 on Monday, Wednesday, and Friday, we are up pushing an exercise in the house. You can do squats in the house. You can do jumping jacks in the house. You can do push-ups in the house. You can make a pull-up bar in the house and pull yourself up. You can do a prolonged walk in the evenings. And these are free exercises. You don't need to pay a subscription for this. Okay? These are free exercises. You can do Kegels in the house. Do you really need a gym to exercise this? No, you don't. So don't create excuses for any reason. Your health is your first wealth. Follow it strictly.